Are you a registered organ donor?
Yes, I am.
No, I'm not an organ donor.
Love to hear why you're not an organ donor.
I want to take this inside of me that I was born with when I die.
I'm Anissa Durham, the health data reporter for Word in Black, and for the past year, I've been reporting on organ donation and transplantation in Black Americans in my series On Borrowed Time. One thing is clear, medical mistrust runs deep and it's discouraging people from registering to be organ donors. This is a problem because Black people have a high need for organ transplantation. For example, Black people have the highest rates of end-stage kidney failure, and yet they have low chances of getting a kidney transplant. So I want to know, how do these misconceptions spread? And more importantly, can the medical community gain back Black people's trust?
Let's do a newspaper haul. I think I got my hands on like 12 different newspapers. So.
To find out more about how myths and misconceptions spread, I talked to Kelsey Russell, who is a media literacy influencer. Have these ideas kind of exacerbated through social media or through word of mouth? Like, how do you think it has spread?
I absolutely think it's social media, right? All of the rumors that I have heard about organ donation have come from social media, or they have come from a person who saw a tweet about, let's say, for example, right, Henrietta Lacks. There might be some type of Black history Twitter, Instagram, X account that tells the story of Henrietta Lacks. And we'll see a retweet from somebody say, this is exactly why I don't get my organs, because they still harvest our organs in the medical system. Suddenly, that quoted tweet has 4,000 retweets and an 8,000 likes. Now we're having conversations not even based in truth. We're having conversation based on someone's opinion about what is happening in the medical system that's not true.
When it comes to misinformation, have you noticed any generational differences in who tends to believe what, or is it pretty consistent across the board?
Man, I would say it's pretty consistent across the board. I think where people are getting the misinformation is the general divide, right? Like, I see my parents are in their 60s, 50s. They even have friends in their 40s. My grandma's in her 80s. And interesting enough, my grandma doesn't fall to much misinformation. However, she is not on social media. She reads the newspaper every day and she listens to her local news every day. But I see a lot of older people who are on Facebook. That's where they're finding a lot of their misinformation. However, younger generations, to me, are just getting the same amount of misinformation, but it might be from like a TikTok or Snapchat. So I don't think the amount is different. I think where we're getting our misinformation is different. And I do think it causes like a fallacy that older people fall to misinformation more because they're on this older Facebook platform, when the reality is none of these social medias are doing the work to actually vet misinformation the way that they should. So all of them are guilty just as much.
I spoke with Aisha Johnson. She's the director of community outreach for Infinite Legacy, an organ procurement organization servicing Maryland, Northern Virginia, and the District of Columbia. Through events like focus groups and health fairs, Aisha and her team talk to members of the community and learn about the barriers that stop people from registering as organ donors.
I've been in organ procurement work since 2007. I just finished a focus group in Maryland, and an individual, they still brought up Henrietta Lacks. They still brought up the Tuskegee experiment. They still brought up something they heard from when they were a child. It's still here, and it's 2025. And where we are today, I don't think it's changed as much.
For those unfamiliar, the Tuskegee syphilis study was a highly unethical experiment conducted by the United States Public Health Service and the Centers for Disease Control and Prevention, where proper treatment was withheld from a group of Black men to observe how the disease progressed. The scientists did not tell the men in the study that treatment was available, and more than 100 people died. Henrietta Lacks was a woman from Virginia who was diagnosed with cervical cancer when she was 30 years old. As part of her initial biopsy, her doctors collected her cells and grew them without her consent. Her cells had the unique ability to grow indefinitely outside the body, which made them great for research, and she was never compensated for it. Their stories are among the many that have been passed down from generation to generation of Black Americans as examples of how the medical establishment has taken advantage of Black bodies. And of course, the fear, disdain, and mistrust that Black people have towards the healthcare system also intersects with how they feel about government institutions, especially the criminal justice system.
Hands up! Don't shoot! Hands up! Don't shoot!
The murder of George Floyd and many others are still fresh in the minds of people in the Black community.
I'm tired of it! I have 3 black men in my home! I'm tired!
The majority of transplanted organs come from deceased organ donors. Donation can be done either after brain death, which means a patient has irreversibly lost brain function, or circulatory death, meaning they have permanently lost cardiac or respiratory function. And 1% of people die in a way that would qualify them as a deceased organ donor. The healthcare team that declares someone dead is not the same team that would prepare someone for organ donation. I spoke to transplant surgeon Dr. Anthony Watkins about what he's heard from his patients and members of the community. So one of the myths that I've heard that kind of started this project for me was that if you register as an organ donor and you're a Black person, you end up in the hospital, they're not going to save your life. I'm curious how often this has come up for you. Has it been studied throughout your career?
I remember at a point in time, I was under this impression that the higher your education, the lower the probability of this myth existing. However, that's not true. And look, when you worked in a trauma bay, worked in an emergency room, you understand the reality that your number one priority is saving a life. You're not going to take the time to find someone's ID to see if they're an organ donor and all. That's not how it works.
I asked multiple sources in my series if they think it's possible to rebuild trust between Black Americans and the healthcare system. And the answers vary. It's not just about addressing this microcosm of healthcare. It's also about addressing access to housing, food, education, and preventive care. One thing that stood out to me was that Aisha, Dr. Watkins, and Kelsey are talking to Black communities directly, providing education and building relationships. For Aisha, that involves not only educating Black people about the realities of organ transplantation, it also includes addressing other needs of the community as well. Aisha helped launch the Decision Project in 2016, a grassroots initiative that provides goods and services to communities in need while educating them about organ donation.
We started with one zip code, right? And that was in Park Heights, Baltimore City, 21215. And it's now an event that is growing bigger than us. And how we do it is we heard them. We heard the individuals say, people like you come in all the time and ask questions, and they never come back. And that was the one thing I took away. And I'm getting chills right now thinking about that. I told my team we have to show up.
And this approach is achieving results. 5 years after working with the community at Park Heights, there was a 500% increase in the number of people who registered to be organ donors. For his part, Dr. Watkins goes out to dialysis centers and churches and talks about kidney disease and transplantation.
We're stressing first and foremost the importance of a healthy lifestyle. And then we, also obviously, advocate and inform the community in regards to for those people who have the disease processes that are at risk for end-stage renal disease, or if they have it, to make sure they're seeing a kidney specialist and to make sure they're getting referred to a transplant center in a timely fashion to get the gold standard treatment for kidney failure, which is a kidney transplant, not dialysis.
As for Kelsey, she's building a digital community and educating her followers to be more mindful about what they see on social media and to take charge of their own health.
It's really important for Black and brown people to be media literate and to be health literate, because our health is literally our wealth. And also in this world where it's a lot of things going on, what we intake in our bodies and what we do with our bodies is a huge sense of agency and privilege. And that is a lot. That means a lot for Black and brown people when we haven't had agency over our bodies for so long. And as I always say, being smarter is like the sexiest thing you can be. So, if you just want to be sexy, that works too.
To read more of my stories in my series on borrowed time, you can visit wordinblack.com. You can also sign up for our health newsletter that comes out every Wednesday.